Memoirs of a Doctor by Dr. Andrew C.S. Goh. Part 4. This world is not our home. We are just passing through. Whatever good that we can do, now is the time to do. We bring nothing when we come. We take nothing when we go. Godliness with contentment is the way to go. Whatever is noble, whatever is true, whatever is lovely, whatever is good, this we will do. Whatever is praiseworthy, whatever is pure, meditate more and more and more. Chapter 4, Housemanship in the Ivory Tower. I have sometimes sat alone here of an evening, listening until I have made the echoes out to be the echoes of all the footsteps that are coming by and by into our lives. Quote unquote, A Tale of Two Cities, Charles Dickens. In July 1977, I found myself working in the Ivory Tower called University Hospital Kuala Lumpur, presently known as University of Malaya Medical Center, UMMC, as an intern or houseman. This was a one-year compulsory training for all medical graduates before being granted full registration as medical practitioners under the Malaysian Medical Council. I spent the first 6 months of internship in internal medicine and the second 6 months in obstetrics and gynecology. Housemanship. I was provided free accommodation in the houseman's quarters located on the 14th floor, which was the top floor of the University Hospital block. This was both convenient and essential, as I have to be on call and I need to be able to access the medical wards very fast whenever I was needed. Accommodation was very basic but adequate for me. My financials started from scratch. I had only 100 ringgit in my bank account when I started housemanship. Truly, this was the best of times, and it was the worst of times. As a medical student, I could only afford a motorbike. So whenever it rained, I will be all wet. Riding a motorbike was also very dangerous in the event of an accident. So with my houseman's salary, I sold my motorbike and bought my first car for 1,000 ringgit, a second-hand Renault model. However, it gave me a lot of mechanical problems and needed regular repairs. So after a few months, I sold it off and bought a 2-door Toyota Corolla sedan for ringgit Malaysia 4,000. This second-hand car served me very faithfully and did not break down at all. Internal medicine. I will start my story with internal medicine first. Each houseman was assigned one medical ward, and I was assigned to Ward 13, located on the 13th floor. I took care of 28 patients. This ward was under the care of one medical officer, one lecturer, and one professor. As a houseman, I was required to know all my patients. The medical officer, lecturer, and professor walked in and out of the ward, but I was there all the time. I worked from 8 a.m. until late in the evening, but I had to be back at midnight to look after the cases in Ward 13. I did not take a liking to this Cinderella call because I could not go anywhere after 12 midnight. My freedom was restricted, but on retrospect, this was good training. It drove home the point to me that life as a doctor was not going to be easy. I needed to have the calling, the passion, the commitment, and the willingness to sacrifice my time wholeheartedly. This certainly was not a profession for those with half-hearted commitment. Housemanship in medicine was an extremely demanding job. My typical day started with an early breakfast in the hospital canteen. Then it was off to the ward to do a fast ward round, making sure that I knew every patient by name, provisional diagnosis, latest blood test, imaging results, management plan, and so on. I had to familiarize myself with any new admission that might have come in the night before. By 10 a.m., the medical officer would come with the lecturer to do the daily ward round. Going from one patient to the next until the last one may take a couple of hours, depending on the complexities of each patient. After that, I had to clerk all the new cases admitted via the outpatient department or the accident and emergency department. My job was to take a full history, do a physical examination, and document these onto the case notes. The medical officer would come by later to check on each case and order the appropriate investigations and recommend the plan of management. Then it was back to clerking new cases, doing procedures, reviewing test reports until 5 p.m. or later before passing the reins over to the next houseman on call. The highlight of my stint in medicine was the weekly professorial grand teaching ward round. My professor will come in at 9 a.m. with the medical officer, and my job was to present every case to her from head to toe. The ward round usually took a long time to complete because the professor was very long-winded with her teaching. She frequently sidetracked by telling us other unrelated stories, but no one dared to interrupt her. By lunchtime, we would have covered possibly 8 or 10 patients at the most, and there were so many more to cover. The team adjourned for a quick lunch break and resumed the grand round until 3 to 4 p.m. After this, I was back to clerking new cases and reviewing reports. By this time, there would be a backlog of cases to clerk, and my day would end very late. One day, a very prominent and famous radio disc jockey was admitted to Ward 13. She used to come on air every night at midnight over national radio with her selection of sentimental songs. She was a client and a good friend of my professor, and I had to give her special treatment. Her voice was so sweet and soothing. Listening to her speak in person was just like listening to her on national radio every night. The housemanship provided me with hands-on experience, learning through apprenticeship, supervision, and bedside teaching. The medical officer was my mentor, and I tagged along with him as close as I could without encroaching too much onto his personal space. Now was the time to put into practice all that I had learned in the last 5 years of medical school. I could be diligent and learn as much as possible, or choose to be slipshod and just do the bare minimum. It was entirely up to me, and I chose the former route. I got on very well with the nursing sisters, building up a good relationship with them over time. I learned a lot from them, as some of them had been in their profession for decades. I also learned a lot from the medical officer, lecturer, and the professor. obstetric and gynecology. After completing the first 6 months in internal medicine, I moved to obstetrics and gynecology for the second 6 months. The stint in obstetric and gynecology was an entirely different ballgame altogether. There was no more Cinderella call. If I was not on call, I would be free, doing all the duties for the day and passing the reins over to the next houseman on call. History taking was short, sweet, and straight to the point. Lecturers and professors did not breathe down my neck and were not interested in a detailed history of each case. Here I learned how to deliver babies, assisted in forceps and vacuum deliveries, assisted in cesarean sections, tubal ligation, vasectomy, and other minor surgeries. I could recollect some dramatic, sad, and humorous incident as well. A Malay lady who worked in the Department of Obstetrics and Gynecology as a clerk came in for a cesarean section and died suddenly the following day. The lecturer said she had a fat embolism, a rare but fatal clinical syndrome. One day when I was on call, a lady who came in for an emergency hysterectomy had a post-operative intractable massive hemorrhage. The professor on call was called into the operation theater. To stop the bleeding, he performed bilateral internal iliac artery ligation and arrested the bleeding. Many pints of blood were transfused, but she survived. The professor was praised for his prompt and life-saving decision. This was the first time bilateral internal iliac artery ligation was done for post-hysterectomy hemorrhage in the university hospital. Of course, the most unforgettable and most painful and most unfortunate incident was the fatal MH653 air crash on the 4th of December 1977, which took the life of the late Professor I.S. Puvan, Professor of Obstetric and Gynecology of University Hospital, plus 7 members of the air crew and 92 other passengers on board. He was a professor with a big heart, impeccable bedside manners, powerful persona, and was well loved by doctors, staffs, and patients. I miss him dearly even up to this day. I recall working in the labor ward one night when he came in and gave 20 ringgit to one of the midwives to buy supper for everyone on duty. In those days, ringgit Malaysia 20 was a large sum of money. According to the Bureau of Labour Statistics Consumer Price Index of the year 2020, ringgit Malaysia 20 in 1977 is equivalent to ringgit Malaysia 86 in 2020. His impeccable bedside manner and pleasant personality were second to none and hard to match. He was the Malaysian equivalent of the television persona Dr. Kildare. Working in the labor ward was both equally exciting and dramatic. We could not predict when patients would come in for labor. They usually came in at the oddest hour of the night, but seldom during office hours. Patients came in with variable degrees of pain. Some came in screaming and shouting, while others came in with more manageable and tolerable pain. It had to do with the respective patient's pain threshold. Generally speaking, Indian women seem to have a much lower pain threshold than women of other ethnicity. They tend to scream and shout with each contraction and demand more and more petidine for pain relief, which is not good for the fetus. I learned a lot from the midwives. Some of them had been in the profession for decades and were very experienced. The Indian word for breathing in and out is muchu, and the Indian word for pushing with all your life is muku. When you want the patient to breathe in and out, you would say muchu. And when you want her to push with all her life, you would say muku. The problem was when the houseman mixed up these two commands and said push with all your life when he wanted her to breathe in and out. And to say breathe in and out when she wanted her to push with all her life. I was told that this happened to some housemen before my stint, but whether this was true or not, I cannot confirm. But then again, as they say, truth is stranger than fiction. Sometimes the truth out there is more bizarre than our imagination. I remember reporting for duty one day in the labor ward after taking over from the previous houseman. The ward seemed to be too quiet because there was no patients in labor. All the midwives were relaxing, having a jolly good time, and you could have heard a pin drop. But being a newbie to the trade, I blurted out with the question, why is there no patients in labor? The midwives rebuked me, saying that I had jinxed them with my question. Not long after this, patients started arriving one after another non-stop until my shift was over. An interesting lesson, this one was for me, that silence is golden. As the saying goes, marriage on 31st August 1977, I married my wife, who was then a final year student in dentistry in the University of Malaya. Upon marriage, we stayed together in the houseman quarters. Page 64. To be continued. Thank you.